Imagine your child suffering from a heart problem, but you can't do anything about it because you have no money to help their needs. Children from the ages of 3 to 17 have been suffering from a loss of health insurance for a long time. Today, I will talk about the problems of not having free health insurance for children in the US. According to ncbi.gov, it says that costs have been an issue for such a long time. The US should support children so that they can be nurtured back to health. The first harm that comes from this is that there are more deaths in children and illnesses among children in the US. HHS.gov states that the administration of children and families help children and many individuals. Medicaid has beneficiaries for only certain sexes. The ACA wants only a single-payer approach for children having health insurance in the US. The second harm is that Americans suffer financially. According to KFF.org, Medicaid provides money to families below the 400% poverty line. The significance of this is that financial disparity should not associate to disparity of health, especially for children and families in the US. The rise of public and private hospitals concerns people. The inherency of this is that there has been ideas for promoting free health insurance to children over the years. This would be considered a structural inherency because there is a problem and it has to do with money. So what is the plan for this? US covers children universal health insurance, and what I want you to do is we must fund Kaiser Permanente. We should start an online organization to fund Kaiser Permanente. The online program guarantees free health insurance. Say, for instance, a child breaks their bone. They need to go and be transported to the hospital immediately. Organizations must be funded to children who get injured in school. Furthermore, the school nurses need to have better equipment. TB tests should be provided every year for physicals at schools. And school nurses should all be professional. Annual checkups are mandatory for children. Medicaid will give free medication for children with disabilities. So how is this all going to happen? The money all comes from funds. The increases in taxes will occur. However, if every state wants to be covered, this must be done. Medicaid says that every household that makes over $100,000 will be taxed 10% of the income. Children's health insurance has state spending, which is $1.9 trillion, the state funding, which is $1.3 trillion, and federal funding, which is $612.2 billion. The funding and staffing for this is that money will be from government organizations, which gives children and families free health insurance. So when do you think might this happen? I'd say approximately 1 year to provide a system for free health insurance to children and family. The companies will get funded for childcare and providing free health insurance to children and families. So how is this problem going to be solved? Well, parents want to use a children's medication for their own benefits. However, Obamacare gives you the right to have your own medication for your child. Obamacare has monthly premiums, and medication should only be limited for children's use and not for parents. Taxes will increase and people won't like that at all. Medication must be given with absolutely no cost. When taxes are raised, money will be used to supply wheelchairs, crutches, etc. It will help foster children with disabilities, and this will overall help. So the advantages of this is that providing universal health care will guarantee a healthy body and lifestyle for every child and family in the U.S. The U.S. will have lower death rates for children because free health insurance is implemented. Parents will know their kids are safe in the school systems. No human will suffer financially because of this and be treated with the best care. According to BLS.gov, it says that the identity plan is a specific plan that gives you back money from the expenses which are incurred. So what I want you to take away from this is to encourage people to aid the agency for healthcare research and quality that supports the needs of individuals' health insurance. Think about all the children's lives that you will be saving because of this. So please fund to organizations that need it.